Good afternoon, everyone. I can see some curiosities in your faces. You all might be thinking, why is she here in this attire? Is this some fancy dress competition or what? Right? I can explain. I did my MS in ophthalmology and then I earned my degree in law. You know why? Because I wanted to protect the career of all those who restore vision, like some of you guys in future. Today, we are beginning with a different kind of class, which is truly the need of the hour. I will be taking you, the topic of the day is how to be legally safe in cataract surgery. Today, I will be taking you through 3 basic case scenarios which I personally encountered in my career. Let's name them preoperative defense, intraoperative shield and post-op safety. Now, let me take you to a different kind of theater, the courtroom. You can see my client, Dr. Sharma, with a sad face. Why is he sad? It's because of this lady, a 62-year-old female patient who received an EDOF lens, that is the extended depth of focus lens, sued him for negligence. She had 2 complaints. Even though she is happy with the distant vision, she still needed spectacles for reading fine prints. Secondly, she is experiencing some visual aberrations. And her main complaint was that Dr. Sharma didn't warn her about this. You know what? Legally, not disclosing a non-outcome is a breach of duty. Can you guess what would have saved her? Saved him? Is the consent. It's a procedure-specific consent. Along with the voice recording of the whole conversation between Dr. Sharma and his patient, I also produced patient initial checklist, which clearly showed that there would be a chance of experiencing photopsias and patient might still need spectacles for reading fine prints. You are eager to listen, hear about the result? Yes, the case got dismissed. In the court, I didn't prove that the patient was lying about her symptoms. I proved that this was a non-outcome and not an act of negligence. Now, let's step into the operation room. You can see my client, Dr. Ria, doing a routine phaco. Uh-oh, what is that? That's the posterior capsular tear, a surgeon's nightmare. You know what she did next? She immediately diagnosed it. She stopped the phaco energy. She injected the viscode, she converted the procedure and did everything that is supposed to be done. She did an anterior vitrectomy and placed an IOA. But then she dropped fragment and hence referred the patient to a vitreoretinal surgeon. What a flawless management, right? But the lawsuits hit. Dr. Ria's patient sued her for negligence. She claimed that the need for a referral and a second surgery is a proof for Dr. Ria's negligence and demanded monetary benefits for the second surgery. Can someone guess what would have saved Dr. Ria here? I will tell you. It's a properly documented OT note. In the court, her OT note acted as a witness. Along with that, I also produced the video recording of the whole procedure, which clearly showed that Dr. Ria managed the situation perfectly. Now, let's dive into third case. In the post-op day 3, a patient called to the hospital's on-call line. Her complaints were mild irritation and fogginess in the operated eye. The hospital's on-call team, following the protocol, reassured her and asked her to visit if her symptoms worsened. You know how the same patient presented 3 days later? Can someone say what is that? Hypopyon. Yes, very good, hypopyon. So this is a case of post-op endophthalmitis. The patient sued hospital saying the hospital staff didn't give much attention to her case and that's the reason why she developed post-op endophthalmitis. They came for hospital's head, but I defended the whole system. In the court, I showed them the whole spectrum of defense, starting from the documentation of sterility, like the installation of antibiotics on the pre-op day and how a sterile environment is maintained in the hospital on the OT. Along with that, we also sent samples from the intravitreal fluids as well as intracameral injections used in the hospital and all got microbiologically tested negative. I also followed up with every single patient who had undergone surgery on the same day and made sure that nobody had a similar complaint. I didn't stop. I even played the voice recording of the call between the patient and the on-call staff where she was clearly mentioning about mild irritation and fogginess and not any red flag symptoms. Thus, I saved the hospital. Now, what did you learn from here? Your pen is your shield. While doing any procedure, you should document it. You should document not only the complications, but also document every corrective method that you have taken. And here comes my favorite part. This is the homework for today. You can take this down. I will also send a picture of this in your group. In the next class, we will be discussing about this case as well as continuing the session. Thank you.
Madam, any examples where doctor was found negligent?
Sorry?
Any case was found negligent in the past?
Yeah, there's a case between like Omina and like uh, Arvind Hospital, I think. There was a case, and there they could prove that the source of infection was from the hospital. So there was a case, yeah. And there are many more cases, but the cases are often less.
Ma'am, in few, like now the students are being trained at various centers. Some have a very good training, some have an appropriate training, some have below average training. So, if the complication rate would be higher in a person who's trained from a below, yeah, who has a below average training.
Sorry?
Who has a below average training, the person who's
Okay,
operating,
okay.
who has a below average training.
Okay.
So, how does the court looks at it?
The court will clearly check if the standard, the protocol has been followed or not. And if it was all done, it's fine.
So, if I am the operating surgeon, and if I operate 100 cataracts and I create 80 rents,
Oh,
then how will court tackle me? I have taken the consent, everything. And
Yeah.
the video has also been made. Rent can happen, but I am making 80 rents in 100 cases. Then,
yeah, if you had done 100 surgeries and if 80 became a rent, then definitely the court will ask you to get better training. He will definitely not let you practice anymore.
Teacher, my BSS has some organism. I am not responsible for it. How do I check BSS before uh, using it for the patient? Do I be punished for that if my patient develops endophthalmitis?
Actually, if you had done all the procedures properly, and if you had taken the proper consent, like in every procedure, there is a chance of post-op endophthalmitis. But there is in BNS, I think it's 304, there is a provision that if you can prove that the infection didn't start from your side, you are safe.
Thank you, Sneha, for frightening all of us with the